As a parent, you're always worried about every little cough and fever. But what if there's an infection that's surprisingly tough to spot? We're talking about urinary tract infections, or UTIs. They're actually really common in kids, but the signs, they're not always what you'd think. So today, we're going to break down what they are and, most importantly, how to spot them.
Okay, so UTIs are one of the most common bacterial infections kids can get. But here's the tricky part. The signs can be super confusing, especially in babies and toddlers who can't just tell you, hey, this hurts. It's awful for them and, a huge source of worry for you. And that brings up a really critical question for every single parent out there. What if the only sign of a serious infection, one that could actually damage your child's kidneys, is just a fever? Yeah, let's really get into that.
All right, so first things first, let's get a clear handle on what we're actually talking about when we say UTI. What is this thing?
A urinary tract infection is, pretty simply, a bacterial infection that happens anywhere along the urinary tract. Now, even though it's common, it can also be really serious. And here's the one thing you absolutely need to know. If a UTI isn't caught and treated, it can lead to permanent kidney damage. That's why spotting it early is, well, it's everything.
So how do these infections even start? Well, most UTIs in kids are what we call ascending. Just imagine bacteria as these tiny climbers. They start out from the normal bacteria you'd find in stool, and then they basically travel or climb from the skin right up the urethra and into the bladder. It's this simple journey that shows why good hygiene is so key in trying to prevent them.
Okay, so you might think you have a pretty good idea of who's most likely to get a UTI, but honestly, the risk profile has some real surprises, especially when we're talking about really young infants. Let's start with a key number. For infants and toddlers under 2 years old who have a fever, there's about a 7% chance that a UTI is the actual cause. Now, that might not sound huge, but it's a pretty significant number for any parent to have on their radar. But now, get ready for this, because this number is a real shocker. In uncircumcised baby boys with a fever in their first 3 months of life, that number jumps to 20%. I mean, that's a 1 in 5 chance, a massive risk factor that a lot of people just aren't aware of. And what's so wild is how this whole risk profile just completely flips over time. In those first 3 months, it's uncircumcised boys who are at a much, much higher risk than girls. But then, after 6 months, the tables completely turn, and UTIs become way more common in girls, especially when they're infants, and then again around the time they're toilet training. So, who's the main culprit behind all these infections? Well, overwhelmingly, it's good old E. coli. This is a super common bacteria that lives in the colon, and it's responsible for something like 2/3 of all childhood UTIs. And that makes perfect sense, right? Especially when you remember that most of these infections are ascending from that exact area. Okay, this is probably the most important part of our whole chat today. It's not just about knowing a UTI can happen, it's about being able to recognize the signs. And most importantly, understanding the huge difference between a simple bladder infection and a much more dangerous kidney infection. So you've got two main types of UTIs to think about. First, there's a lower UTI, which is called cystitis. That's just an infection hanging out in the bladder. But then there's an upper UTI, or pyelonephritis, and that means the infection has traveled all the way up to the kidneys. As you're about to see, that distinction is absolutely crucial. Let's really break this down. A lower UTI, that cystitis, is what gives you those classic symptoms you've probably heard of. It hurts to pee, they have to go all the time, maybe their urine smells funny. But here is the critical point. A simple bladder infection does not cause a fever, and it doesn't injure the kidneys. An upper UTI, on the other hand, is a whole different ballgame. The symptoms are more body-wide. A fever, tummy pain, vomiting. This is the one that can cause permanent kidney scarring. And that right there brings us to the single most important thing I want you to take away from this entire explainer. When it comes to a serious kidney infection in a little kid, the evidence is so clear. A fever might be the only sign. Just let that sink in for a second. All those other classic UTI symptoms could be totally gone, leaving you with just a fever. So let me be crystal clear. In an infant or a toddler under 2 years old, a high fever that has no obvious cause, I'm talking no runny nose, no cough, no signs of an earache, that should immediately make you think about a UTI. It is the most common sign of a serious kidney infection in this age group. Okay, so you think your child might have a UTI. What happens next? Let's walk through the diagnosis process so you know exactly what to expect when you get to the doctor's office, and hopefully it'll feel a little less stressful.
So while all those symptoms are really important clues, they can't actually confirm a UTI on their own. For that, the gold standard is something called a urine culture. This just means a urine sample is collected in a very specific way and then sent to a lab to see if a significant amount of bacteria grows.
And collected in a very specific way is the key phrase here. For kids who are already potty trained, a clean catch sample usually works just fine. But for babies and toddlers, the most reliable and common method is using a catheter. Now, I know that can sound a little intimidating, but I promise you it's a super quick, routine procedure that doctors do all the time to get the most accurate result possible. The third method, suprapubic aspiration, is way less common.
What's really interesting is that a positive diagnosis isn't just about finding any bacteria, it's about finding enough of it. And the amount they need to find actually depends on how the sample was collected. Think of it this way. A clean catch sample could easily pick up some harmless bacteria from the skin on its way out. That's why for that method, doctors need to see a really high number, over 100,000, to be sure it's a true infection. But with a sterile catheter sample, that number is much, much lower. It's all about making sure it's not just contamination. So on top of that mean urine culture, your doctor might do some other tests. A quick urinalysis, it's like a dipstick test, can give them some early clues, like finding white blood cells. For kids who seem really sick, blood tests might be needed. And after a confirmed UTI, especially a kidney infection, they'll often recommend a renal ultrasound just to check and make sure there aren't any underlying issues with the plumbing, so to speak. So we've gone over what a UTI is, who's most at risk, and that absolutely critical difference between a simple bladder problem and a serious kidney infection that might just show up as a fever. The big takeaway here is just to be vigilant. Knowing that an unexplained fever in your little one is worth a call to the doctor, that's not just information. It is your most powerful tool for protecting their health.